mynews.studio.
A virus that once paralyzed thousands every week is now found in just 2 countries. How did we get so close to eradicating polio? And what's keeping us from finishing the job?
Today is November 28th, 2025. To understand the scale of what's changed, let's go back. In the early 1980s, polio was paralyzing more than 1,000 children every day worldwide. Over 300,000 cases a year, spread across more than 125 countries. It was a global crisis.
It's genuinely hard to capture what happened after that. Since then, polio cases have dropped by more than 99%. In the last few years, we're seeing just around 50 cases globally. The key moment was in 1988, when the Global Polio Eradication Initiative launched. That brought together WHO, Rotary, CDC, UNICEF, and the Gates Foundation.
And that partnership mobilized over 20 million volunteers across more than 200 countries. The goal was to wipe out polio by the year 2000. It was ambitious, some said unrealistic, but the results are hard to argue with.
Exactly. Vaccines have prevented an estimated 29 million cases of paralytic polio since the 1950s. Between 1988 and 2021 alone, the global initiative averted 24 million cases. And the impact goes further. Over 1.5 million deaths avoided, and 16 million people spared paralysis.
Just to ground that, in 1980, there were about 50,000 reported cases. By 2021, that dropped to 649. The Western Hemisphere stopped polio transmission by 1991, and Southeast Asia, once the hardest hit, hasn't seen a single case since 2011.
And now, 2 out of the 3 wild poliovirus types are gone. The investment behind this is significant. The initiative has received about $20 billion in funding since it began, with about $1 billion each year. The payoff? Net benefits could be in the range of $40 to $50 billion, especially compared to what countries could have done alone.
That money wasn't just for vaccines. It completely changed vaccination infrastructure. Back in 1980, only about 22% of 1-year-olds worldwide had polio vaccine coverage. By the 2010s, that was up to over 80%. The oral polio vaccine, in particular, made it possible to reach children in places that were previously out of reach. Why was that game-changing?
Oral vaccines are easier to use. No needles, no need for highly trained staff, and they're less expensive. That's how campaigns reached remote villages, dense urban slums, even conflict zones. Countries like Brazil, Cuba, and Mexico saw cases drop quickly when they switched to oral vaccine campaigns.
But despite all that progress, the last mile is the hardest. Wild poliovirus now survives only in Afghanistan and Pakistan. That's down from 125 countries in 1988. The challenge is these last 2 are the toughest. Ongoing conflict, limited healthcare, and vaccine hesitancy all make eradication difficult.
Take Pakistan. Over 3 decades, cases dropped by 99.6%. That's from 20,000 cases a year to just 74 in 2024. The strategies included door-to-door vaccination, sensitive disease surveillance, and working closely with communities. But are those strategies enough now, with new barriers emerging?
It's a real concern. Surveillance systems in both countries are now far more sensitive than even a decade ago. Still, instability and mistrust make it hard to reach every child. The campaign relies on data-driven targeting and constant adaptation. So it's not just about delivering vaccines. It's about building trust and navigating conflict.
The impact extends beyond polio, too. The health infrastructure built for polio eradication is now a backbone for tracking other diseases. During the Ebola outbreak in Africa, the same surveillance networks helped detect and contain Ebola cases. Could this model help with other infectious diseases, too?
Yes, definitely. This is proof that consistent investment in disease monitoring, vaccine delivery, and community outreach pays off, even in a crisis. It's not just a legacy. These are resources being used right now.
But as we approach eradication, new risks come up. vaccine hesitancy is becoming a bigger challenge. There are also funding gaps. If the virus comes back, it could spread fast to polio-free areas, with hundreds of thousands of new cases possible.
That's why continuous surveillance, strong political commitment, and developing new vaccines matter so much. The story of polio isn't just science. It's about the decisions we make. Do we finish the job or risk losing all the progress?
We're at a turning point for global health. The world has come 99.9% of the way, but the last 0.1% is proving the hardest. Will we make it across the finish line, or could we see polio return?
That's the challenge. It's not just about public health systems. It's a test of our collective resolve.
From 1,000 children paralyzed every day to just a handful of cases left, the story of polio is one of scientific progress and human determination. The finish line is visible, but these last few steps matter most.
Thanks for joining us. We covered how polio was nearly eradicated, the global effort behind it, the health systems that have changed public health, and the risks still ahead. The journey isn't over, and what happens next is critical.
Thank you for listening. This episode was brought to you by mynews.studio. You can try it now for free.